As a parent, there's nothing more important than the well-being of your child. We all want our children to live long, healthy lives, but invisible threats like influenza can pose serious risks, especially to children with pre-existing conditions. The flu can lead to severe complications. Children with neurological conditions are more vulnerable. They may experience worsening symptoms or new complications. It's crucial to understand the risks and take proactive steps. Vaccination and early treatment are key. Before we delve into the neurological risks of influenza, it's essential to understand the basics of this common, yet potentially serious respiratory illness. Influenza, or the flu, infects the nose, throat, and lungs. It's different from the common cold. The flu is highly contagious, spreading through respiratory droplets. These droplets can infect others. Surfaces can also spread the virus. Symptoms include fever, cough, and fatigue. Some may experience vomiting and diarrhea. Most recover in a week or two, but some face serious complications, especially those with underlying conditions. Even healthy children can be affected. Understanding the flu is crucial. Protecting our children starts with knowledge. While influenza typically affects the respiratory system, it can sometimes lead to neurological complications, particularly in vulnerable populations like children with pre-existing neurological conditions. These complications arise when the virus spreads beyond the respiratory tract and affects the brain and central nervous system. One of the most concerning neurological complications of influenza is encephalitis, which is an inflammation of the brain. Encephalitis can cause a range of neurological symptoms, including fever, headache, confusion, seizures, and even coma. It can be a life-threatening condition, especially if not diagnosed and treated promptly. Another potential neurological complication of the flu is seizures. Seizures are caused by abnormal electrical activity in the brain and can manifest as convulsions, staring spells, or loss of awareness. Children with pre-existing seizure disorders, such as epilepsy, may experience an increase in seizure frequency or severity during a flu infection. It's important to note that while neurological complications from the flu are relatively rare, they can have serious long-term consequences, especially for children. Early recognition and treatment of these complications are crucial for improving outcomes and minimizing potential long-term effects. Neurological conditions encompass a wide range of disorders that affect the brain, spinal cord, and peripheral nerves. These conditions can manifest in various ways, impacting a child's movement, coordination, speech, behavior, and cognitive abilities. Epilepsy, one of the most prevalent neurological disorders in children, is characterized by recurrent seizures caused by abnormal electrical activity in the brain. Children with epilepsy may experience different types of seizures, ranging from brief staring spells to prolonged convulsions. Cerebral palsy, another common neurological condition, affects muscle movement and coordination. It is caused by damage to the brain that occurs before, during, or shortly after birth. Children with cerebral palsy may have difficulty with motor skills such as walking, talking, and eating. Other neurological conditions that can increase a child's vulnerability to influenza complications include muscular dystrophy, spina bifida, and autism spectrum disorder. Children with these conditions may have weakened immune systems, making them more susceptible to infections like the flu. Understanding the specific neurological condition your child has is crucial for assessing their individual risk and taking appropriate preventive measures. Children with underlying neurological conditions are at an increased risk of developing severe complications from influenza compared to their healthy peers. Several factors contribute to this heightened vulnerability. Firstly, neurological conditions can weaken the immune system, making it harder for the body to fight off infections like the flu. This weakened immune response can lead to more severe flu symptoms and a higher risk of complications. Secondly, children with neurological conditions often have underlying respiratory problems, such as difficulty swallowing or weakened respiratory muscles. These respiratory issues can make them more susceptible to respiratory infections, including influenza. Thirdly, some neurological conditions can affect the brain's ability to regulate body temperature, making children more susceptible to fever and its complications, such as seizures. A high fever, a common symptom of the flu, can be particularly dangerous for children with neurological conditions, as it can trigger seizures and worsen existing neurological symptoms. Given these increased risks, it is paramount to prioritize influenza prevention for children with neurological conditions. Vaccination, along with other preventive measures, plays a crucial role in safeguarding these vulnerable children from the potentially severe consequences of the flu. Protecting our children from the flu starts with understanding the importance of vaccination. The flu vaccine is the single most effective way to prevent influenza and its potentially serious complications, especially for children with neurological conditions who are at increased risk. The Centers for Disease Control and Prevention recommends that everyone 6 months of age and older get an annual flu vaccine. This is particularly crucial for children with neurological conditions, as well as their close contacts, including family members, caregivers, and healthcare providers. The flu vaccine works by exposing the body to a weakened or inactivated form of the influenza virus, which triggers the immune system to produce antibodies that protect against the virus. While the flu vaccine may not completely prevent influenza infection, it significantly reduces the risk of getting sick, being hospitalized, and developing severe complications from the flu. It's important to note that the flu vaccine is safe and well tolerated by most children, including those with neurological conditions. Side effects are usually mild if they occur at all, and may include soreness, redness, or swelling at the injection site, low-grade fever, headache, or muscle aches. Choosing to vaccinate your child is not just about protecting them, it's also about protecting those around them who may be more vulnerable to the flu, including infants, older adults, and people with chronic health conditions. While vaccination is the cornerstone of influenza prevention, early detection and treatment are equally crucial, especially for children with neurological conditions who are at higher risk of developing complications. Prompt medical attention can make a significant difference in mitigating the severity of the illness and preventing long-term consequences. If your child exhibits any flu-like symptoms such as fever, cough, sore throat, or body aches, it's essential to contact your healthcare provider immediately. Early diagnosis is crucial for initiating appropriate treatment, which may include antiviral medications. Antiviral medications work by interfering with the influenza virus's ability to replicate in the body. When administered early in the course of the illness, these medications can shorten the duration of flu symptoms, reduce the severity of the illness, and lower the risk of complications such as pneumonia, ear infections, and hospitalizations. It's important to remember that antiviral medications are most effective when started within 48 hours of symptom onset. Therefore, don't delay seeking medical attention if you suspect your child may have the flu, especially if they have underlying neurological conditions. While vaccination and early treatment are paramount in protecting children from the neurologic risks of influenza, several everyday preventive measures can further reduce the risk of infection. Good hygiene practices are essential in preventing the spread of germs, including the flu virus. Encourage your child to wash their hands frequently with soap and water for at least 20 seconds, especially after using the restroom before eating, and after blowing their nose, coughing, or sneezing. If soap and water are not readily available, alcohol-based hand sanitizers containing at least 60% alcohol can be used as an alternative. Teach your child how to cover their mouth and nose with a tissue or their elbow when they cough or sneeze to prevent the spread of respiratory droplets. Avoid close contact with people who are sick, and keep your child home from school or daycare if they are exhibiting flu-like symptoms. This will help prevent the spread of the virus to others. Maintaining a clean home environment is also important. Regularly disinfect frequently touched surfaces such as doorknobs, light switches, toys, and electronic devices to reduce the spread of germs. Protecting our children, especially those with neurological conditions, from the potentially serious consequences of influenza is a shared responsibility. By understanding the risks, embracing vaccination, seeking early medical attention, and practicing everyday preventive measures, we can create a safer and healthier environment for all children. Remember, children with neurological conditions are at an increased risk of developing severe complications from the flu. Vaccination is the single most effective way to prevent influenza and its potential complications. Early detection and treatment of influenza are crucial, especially for children with neurological conditions. Antiviral medications can shorten the duration of illness and reduce the risk of complications when administered promptly. Beyond vaccination and early treatment, everyday preventive measures such as good hygiene practices, avoiding close contact with sick individuals, and maintaining a clean home environment can further reduce the risk of influenza infection. By working together, parents, caregivers, healthcare providers, and educators can create a protective shield around our most vulnerable children, safeguarding them from the threat of influenza and empowering them to live healthier, happier lives.